All right, everybody, we're going to go ahead and get started with our panel presentation today. I'm Debbie Fox with the National Network to End Domestic Violence. I do housing policy and assistance and training here as a part of my work with the National Network, and then also part of the DV and Housing TA Consortium. I'm really excited that you all could join us today with our DV HTAC COVID-19 special topic series. We are at the 6-month mark of doing our work, our housing work, and our domestic and sexual violence work in the field in the light of COVID and the current situation that we're in. And so we all have heard this past week just that there's been 200,000 deaths as it's related to COVID. So it's just a time of reflection and pause as we think about this, but then also as we move forward during our work, we want to make sure that we are in the field and addressing issues that are impacting survivors, and in particular housing access for survivors in community of color. So it's a very timely conversation as we continue our work and think about how we're addressing COVID and thinking about how we're working to house survivors who are most impacted by COVID, which are communities of color. So we have a whole list of amazing presenters and guest presenters today that I will let my co-facilitator, Veronica Mills, who will be facilitating the conversation, introduce. But at this point, we have just a quick overview of the DV Housing Consortium. We want to get to the panel really quick, but we are doing this work in community and collaboration with the DV Housing and Technical Assistance Consortium, and that is with our federal partners. There's a number of federal agencies who are supporting this work, and that includes the Family Violence Prevention Services Office, the Office of Violence Against Women, the Office of Victims of Crime, the HUD Office, the Special Needs Assistance Program for Homelessness and Housing Programs, and then also the U.S. Interagency Council on Homelessness, which is where Veronica works. And so we also do this work in partnership with the national TA providers, and some of the folks are behind the scenes on this call helping out as well. We work closely with the National Alliance for Safe Housing, which is a DVTA provider, Collaborative Solutions, which is a HUD technical assistance provider, my shop, the National Network to End Domestic Violence, also the National Resource Center on Domestic Violence, the National Sexual Violence Resource Center, and also the Corporation for Supportive Housing, which is also another HUD-T provider. So that's a lot of partners, acronyms, but as we know, this work takes partnership and collaboration, and so we're modeling that today with all these different consortium partners, and then also our community programs on the ground who are working to get resources and HUD-related resources, DV resources, local, state resources out on the ground to make sure people stay safely housed, or if they're in dangerous or violent situations, that we house them quickly and use the resources to do so. So we have a quick video I want to show you that is how we're framing, how we think about the intersection of DV and homelessness and racism and sexual violence that really gets in a short snippet, and you're welcome to use this in any of your trainings or communities. It just gets to the core around some of the historical inequities, racial inequities in housing, and how that intersects with also gendered and domestic and sexual violence. So we're gonna play the video, and then I'll pass it over to Veronica at USICH, and she'll get the conversation going. And we will be recording this panel discussion, and we encourage you to introduce yourselves in the chat box, and please, any questions that you have, add them into the chat box, and we will compile them and work to answer them at the end. And we also have a few questions for panelists that we came up in advance. So that's it. I think we'll watch the video now and then go into the discussion. So thank you all.
Homelessness is an issue that far too many people face. People of color, specifically Black people, other persons of color, and Indigenous people, experience homelessness in a dramatically different way than their white counterparts. People who hold multiple identities, such as those who live at the intersections of disability, immigration status, sexual orientation, gender identity, and more, experience compounded barriers that further homelessness and housing instability. A recent study found that 66% of people experiencing homelessness were Black, while 28% were white. Black individuals are only 13% of the US general population, compared to 74% of those who are white. Rates of homelessness within Native communities are 3 to 8 times higher than that of the general population. In total, 78% of people experiencing homelessness identified as people of color. This overrepresentation of Indigenous, Black, and other people of color experiencing homelessness cannot be explained by poverty or identity alone. Structural racism, historical policies, institutional practices, and cultural narratives that perpetuate racial inequity put people of color at a disadvantage in obtaining safe and affordable housing. Statistically, women of color are much more likely to experience domestic and sexual violence, and survivors often face network impoverishment. Network impoverishment occurs when the addition of a financially distressed household member places an extra strain on family resources. Oftentimes, we tell a survivor experiencing homelessness to go to a relative or friend's house. However, network impoverishment can cause immense burdens on the existing limited finances and available support from that network. Racial disparities arise at every juncture, from the legal system, to housing, to healthcare, to child welfare, to public benefits. Understanding the intersections between domestic and sexual violence, racism, and homelessness, and applying an equity, survivor-centered lens in our work is the only pathway to stability, safe housing, and healing for all survivors. If we want to address racial inequity, we have to acknowledge it, learn about it, and talk about it, so we can do more about it together. To learn more, visit safehousingpartnerships.org.
Hello, so I'm Veronica Mills from the U.S. Interagency Council on Homelessness. We're 19-member agencies working together to end homelessness at the federal level. We have about an hour for this discussion, and we have panelists from a few different organizations. And I'm gonna let folks introduce themselves and then we can get started. We have about an hour for the discussion, and then we will also leave about 20 minutes for attendees to be able to sort of like discuss and ask questions. So you can also be submitting questions as we're chatting. And then at the end, we will leave time for folks to respond to that. Okay. So you guys want to introduce yourselves and then we can jump to the discussion?
I can start. Hello, I'm Marta Pereira, and I am with Enlace Comunitario. Enlace Comunitario is a nonprofit organization that focuses on providing direct and intervention services in the immigrant community. We're based here in Albuquerque, New Mexico, and we've been here for 20 years. Thank you.
Hi, I'm Dr. Angela Parker with the Genesee Center. For those of you who are not familiar with our organization, we are the oldest domestic violence intervention program in South Los Angeles. We're actually celebrating our 40th anniversary this year, which we're incredibly excited about. We are one of the biggest providers of housing for women, particularly Black women who are victims of domestic violence in Los Angeles County. We have an emergency shelter where families can stay for up to anywhere between 30 to 45 days. And we have 2 transitional housing apartments where they can stay for up to 2 years. And what we do in addition to shelter is we offer supportive services to get back on their feet. So we have a very robust legal program, mental health program, vocational education, parenting classes, life skills. Our goal is to make sure that when our clients leave us, that they are self-sufficient and that we've taken care of some of the barriers that typically lead them to going back into a shelter program. And I'm just happy to be here. Thank you.
I can go next.
My name is Jaya, and I work for a domestic violence agency in the Santa Clara County in California. The name of our agency is Maitri. We work with the South Asian population in the Santa Clara County and beyond. because we do get calls from all across the country and even outside the country. At Maitri, we provide wraparound services, starting with a helpline where a survivor can call in, and that's where her journey starts with Maitri. And then we have a legal program which supports a survivor through all their legal issues, right from filing for a restraining order to getting custody of their children and financial settlement. And we also have an immigration program that helps with the immigration issues that many of our clients do face. And once they are kind of little over their legal cases and things are all kind of settled, then we offer them our economic empowerment program, which works on them building their skills to find a good, stable job that will give them economic security for life. And we also have a housing program, and our housing program consists of a transitional housing that Maitri runs, where DV survivors can stay for a longer period in time when compared to a shelter. And we also have the other aspect of our housing program is where we provide them with long-term rental assistance. And we also have a mental health program that offers counseling to our DV survivors. And so Maitri tries to provide all services that is needed for a DV survivor to get back onto her field, onto her feet and rebuild her life. Thank you.
Arti, did you want to introduce yourself?
Sure. Hi, I'm Arti Subramanian from ACI, and ACI stands for Asian Americans for Community Involvement, and we're based out of San Jose in California. I work as a housing coordinator with ACI, and we are a nonprofit providing services like health, behavioral health, and wellness programs in Santa Clara County. Our domestic violence program provides an emergency shelter where families can stay for about 6 weeks, as well as also providing legal services and housing services like short-term rental assistance and case management to our DV and human trafficking clients, while working closely to ensure that they are housed at the end.
Good morning or good afternoon, wherever you are. Welcome and thank you for joining us this morning. My name is Sahan McKelvey. I work with SEI, Self Enhancement Inc. in Portland, Oregon. We are a culturally specific multi-service organization, primarily serving our African American community here in Portland, Oregon, and serving our community in a variety of ways. I am the Director of Restoration and Identification for SEI, and oversee our anti-domestic and sexual violence programming, as well as our homeless housing programming, our child welfare advocacy programming, legal consultation, and employment services. So those are some of the things that we provide at SEI, the things specifically that I oversee. I don't want to take all of our time describing all of the aspects of our agency, but we are very much supportive of everything that we are talking about today, and determined to provide the type of culturally specific wraparound supports for our survivor community here in Portland, Oregon, that allows our community members to feel supported and loved and like they have access to opportunities to be in a place where they are empowered and self-sufficient and able to move forward towards success that they define.
Thank you for that. Okay, so we can jump into our discussion now. So the first question we have is, what are some of the biggest challenges for survivors finding a safe place or shelters?
Hi, this is Angela with Genesee. So from what I see, the biggest challenge is space. So you guys have all heard the statistics about, especially since COVID, the people who are identifying as domestic violence victims have skyrocketed. And so as shelter services, typically you only have so much space. You're only able to house families who are a particular size. You're only able to house them for a particular amount of time. And so that's kind of really the biggest barrier, is really finding places that are able to take families in for the time that they need to come in.
I agree with Angela that one of the biggest barriers is shelter space, because shelters can only accommodate so many people, and they need and a space opens up only when they are able to exit a person out of the shelter, right? If they are not able to exit the person to another safe shelter or safe housing, then that space is not open for a new person to come in. So shelter space is a big thing. And the other thing that in our experience at Maitri, what we have experienced with the immigrant population that we work with is the fear of going to a shelter. Our DV survivors will not leave at this point, I think I have to call them victims, because they have not yet left the situation. They do not want to leave the abusive situation because they are scared to go to a shelter. And most shelters will require a restraining order. And again, this is a cultural thing with our South Asian population, where many of them do not want to file a restraining order, right? Because there's a lot of family pressure and they just don't want it. They don't want, even though abuse has happened, they don't want to see their spouse or the person with whom they have led a life go to jail. So they would not want to file a restraining order. And that kind of sometimes prevents them from entering into shelters. So these are the challenges we face with the South Asian population that we serve.
And some of the challenges, I agree with both of Dr. Angela and Jaya. And one of the things, a few of the things that we're seeing here in Albuquerque, New Mexico with our population, it continues to be the lack of affordable housing, transportation. We are non-residential agencies, so we depend on shelters for collaboration, and we know that the space has been an issue as well. Immigration status, fear of deportation, and because of the limited services that are available and the lack of knowledge of those services, we're having to do more of the outreach as well in finding ways in supporting our survivors as they seek our services. So a huge thing as well when we're connecting to shelters is language barrier. Oftentimes there is shelters that don't have employees that speak the languages, and oftentimes they do have online interpretation or telephonic interpretation services, but that's not as, as friendly as the in-person or those type of services. So those are some huge barriers that we're seeing. The lack of emergency assistance, oftentimes it takes a while to house survivors into a home. So, obtaining resources or seeking resources for shelters or hotels, vouchers, while they're seeking for a home. So those are some of the barriers that we're seeing in our community, especially with the survivors we serve.
And so what kinds of supports? I know you mentioned some emergency services being available, but what other sorts of supports will help to address these challenges?
Well, I thought Marta made a good point that kind of segues into your question. I think for a lot of our clients specifically, a lot of us I think are culturally specific. We deal with populations who have a distrust of social systems in general. And so I think, creating programs and services that are culturally relevant or culturally competent, or however you culturally sensitive, however you the language that you use in house, is really important to be able to service this. Like I love what Jaya said about understanding that their clients don't want to do restraining orders against their husbands. Neither our clients don't either. And so that was a barrier to them coming into the shelter. Language barriers, coming into shelters where people don't look like you or they don't understand your story. And so there's all this, implicit bias in the way that they treat you. They don't understand why you don't want to program. Because in your household, you were told that therapy is not something that you do, right? Or something that you're allowed to indulge in. Not understanding, again, as you talked to before, when I leave here, I don't have a relative that I can go stay with because they're suffering a lot of the same issues that I'm suffering from. So I think it's just a better understanding of the cultural norms and values of the population that you're working with, and really what it is that they need is, in my opinion, a really great place to start when you're servicing your population.
Yeah, to add on to what Angela is saying, I do agree with her, because cultural responsiveness is so important when you're working with different populations, to be able to understand and meet them where they are at. And one of that is language. One of the things I've noticed in my experience, that when a DV survivor comes in and she's able to connect with one of our advocates in the language that she speaks in, things change dramatically, right? The first thing is she feels like, okay, there is somebody to whom I can talk to, whom I can tell what I want to. So that's one of the things that our agency focus on, is to be very culturally responsive. Not only language, it's also religion, ethnicity, caste, because South Asia is such a wide region and it has so many of these issues. So we are open and accepting of anybody from any part of South Asia that comes and reaches out to us. And at the shelter things earlier, what we have found is many of our clients had issues with language. And another thing, a big issue with South Asians is the food, because vegetarianism is a big thing back in South Asia. And the things are, it's like if somebody is used, they won't use the same vessel or utensil in which meat has been cooked. It is considered like taboo. You cannot do that. So when they go into shelters and they have to even share those cooking utensils, it's just such a big deal for them. So when I'm saying all these things, what I'm saying is, as advocates and as case managers, if we are working with disadvantaged, marginalized population, we have to be their voice. We have to speak up for them. If they need to go to a shelter and they are having barriers, we need to step in for them and then be their voice. And anything else, right? Any service that they are accessing, I think we need to step up and be the voice that they are not able to speak out, right? That their voice is right now silenced. You have to support them until they are able to start speaking on their own behalf.
Absolutely.
Colleagues are making very good points. One thing I just want to piggyback on, a couple of things Dr. Parker talked earlier about the lack of trust that a lot of minority communities and communities of color have for social service organizations in general. And just want to point out and make sure we acknowledge that that is not paranoia. That is very well-earned distrust. Our social systems have been abusive to our communities of color over decades. Mm-hmm. And those are the experiences that our people know. Even with us as culturally specific agencies, we have to be able to break down that lack of trust. And we have to be willing to acknowledge, define our awareness of what's going on, and be intentional about doing something different to serve our communities. And I think those are steps that need to be taken across the board. We watched the video to start this presentation that started to paint a picture of the framework that exists in our country around just the disproportionate suffering. You can talk about homelessness, you can talk about experiencing domestic violence and abuse, you can talk about poverty, you can talk about unemployment. All of those indicators of suffering are disproportionately experienced by our communities of color, and we can't say that our response to that is going to be to do the same things we've always done, but try to package those things for this different community and expect that to work. We have to be more intentional about how are we going to serve our communities of color. Jay has started to talk about some of those things, some of the things that we can do differently, but all the stuff that is being brought up is very real. Are experiences that people are facing every day. When we talk about not wanting to do restraining orders, not wanting to file police reports, not wanting to go to shelters, that's not because I don't want protection. It's not because I don't want a roof over my head. It's because I have been historically trained to feel like these options are going to be less safe for me than the unsafe option that I find myself in right now. And we have to be able to look at those options and reframe those in a way that can bring a new message, that can start to reframe the thought process that our folks are going through, that can look like this is a safer option for me, as opposed to an unsafe option, or even sometimes the lesser of two evils. Like that shouldn't be what we're offering either. We shouldn't be offering, that's bad, this is bad, but it's less bad than that, so come to our shelter. We need to be offering safe options that bring hope, that bring healing, that bring opportunities for folks to be able to move forward in a way that allows them to feel empowered and successful.
Absolutely. That was great. I think that's what's so important about this session is I do think that the federal government has an important role to play in that, just looking historically at our relationship with people of color and vulnerable populations. And so my hope for this is that we are going to do a better job of starting to inform policy, and so that we can lead in this space the way we should be around these issues. And so I'd like to jump into the next question. Are there programs or services that make it easier to navigate or understand, work through the homelessness system and make it more accessible and safe for survivors? So what is working?
What we do at ACI is we try and build partnerships with the other homelessness agencies in our county. We could have a warm handoff process. For example, if a DV client goes into a homeless agency, and maybe if they are not equipped to handle or they're not trauma informed, so we work around with them where they could refer clients to us, and we could provide better services or more services which would lead to empowerment of our clients. And the language line has definitely been working very well with us because we cater to a huge population and we may not have an advocate who speaks the same language. So definitely the language line has been working really well to connect with clients better.
Veronica, I think that there are programs and services that make it easier to navigate our various housing systems, but there are also programs and services that don't make it easier to navigate our various housing and survivor-centered systems. And if I'm a survivor experiencing homelessness, I don't know what's which.
Right.
When I go somewhere, I don't know if this is one of the places that's going to help make it easier or if I'm going to get the runaround. And I think one of the biggest steps we have to be able to take is creating more interconnectedness for our systems. In our county in Portland, Oregon, we have a domestic violence housing system. We also have a family housing system and an adult housing system and a youth housing system. And they're not always interconnected. And I don't know which is going to be the best fit for me. And I don't know when I go to this program, is this going to be the one that makes my path easier? And that's something that I would love to see us be more intentional about changing, that no matter where I go, I'm a survivor experiencing homelessness, I walk into a door or I go onto a website or I call a hotline number for somewhere, and I'm going to get a person, a compassionate and empathetic person on the other end who's going to be able to help guide me through the system that's going to be the best fit for me. And I think we try to have all of our advocates as well versed in all of our systems as we can, but that's not always the same experience everywhere. And creating that kind of a universal experience is where we need to be, because again, like I said, there are systems that work, but there are systems that don't work. And we need to make sure that our survivors are able to access something that works, no matter which door they're able to walk through.
Yeah, I agree with everything that he's saying, all the points. Of course, all agencies, all people working towards homelessness, there have to be connected, right? It's not like one person is doing something and you send one of our survivors there and then it doesn't work for her, and then she just comes back saying that, oh, it didn't work, I don't have any place to go, right? Yeah. So, but in Santa Clara County is fortunately it is much more proactive in addressing homelessness. There's a lot of work that's going on within the county in the homelessness area, and here I wanted to talk about, there is a specific need that most of our DV survivors have, that is confidentiality, right? They don't want to approach big agencies or government agencies or something else because they are very scared that their confidentiality will be out. But the county has been very good in working with us and providing a different avenue for the DV agencies to work with the homelessness prevention system, where we are, the details of our DV survivors are not put into the database where everybody else's data information is there. So we are, in that sense, we are fortunate, and I think that is needed for many DV survivors because of the fear they have, right? A lot of people have a fear of the abuser for a long time, right? It's not like it happened, they leave the relationship and the next day things are okay. It goes on for a long period of time. So the first thing is, if all the systems understand what the requirement of confidentiality for DV survivors, I think that's a good beginning, right? You can start from there and then you can add on the other things that DV survivors would need.
I think another step that has been good that we're starting to progress towards is lowering the standard of proof, or the bar that a survivor has to cross to convince you that I am experiencing domestic violence. And we move to a lot of systems now where it's just self-report. If you say you are, then we are supposed to believe you that you are, and we afford you the rights to go along with being a DV survivor. And you're able to access housing systems that are supposed to be accessible for DV survivors. And would love to see us continue to move that direction. I think especially for communities of color, and this has been touched on already, it is not like a culturally accepted thing to come out and say, I am a domestic violence survivor. Hasn't been our norm in our community. So I don't think we've ever had a problem of a whole bunch of folks trying to abuse systems by falsely making claims that they're experiencing domestic violence. That might happen, but that's rare.
Yeah.
What happens much more often is I am discouraged from getting out of my situation and discouraged from being able to tell my whole truth because people don't believe me. I make a claim, I state my truth, I tell you what I'm experiencing, and I'm held to a standard of, well, tell me more, convince me that you're really experiencing this. So moving away from that, I think, has definitely been a positive step. Going towards a system that allows survivors to self-report in a way that I don't have to share all the traumatic impacts of my experience. I can just say, I'm experiencing domestic violence, and that is enough, and that should be enough, and that has definitely been a positive direction for accessing systems and services.
Something that has also worked for us, and I can go back to what Artie had mentioned in the beginning, is the networking and collaborations, not only with other agencies within our community, but also funders, educating them about DV requirements and how our program works. And I think that has helped in order for them to understand that there's information that we will not share, but also be supportive of our services. So I think education has come a long way. Even within the state, some housing fundings that come, we have set those limits in terms of we will, but this is how our program works, and just make sure that protecting our survivors' confidentiality and the information that's at the top when we're trying to collaborate with either funders or other agencies. So that has been huge for us, and it's made it easier as well.
Yeah, and I think one of the things we've run into, and I'm sure everybody has run into, is for some reason, people don't seem to understand that homelessness and DV are the same issue, that people are homeless because of domestic violence. And so there's like all of these like specific rules for homelessness, and even the pots of money for homelessness that DV service organizations have had to fight to tap into, even though we're serving the population, even though statistics show that the majority of women are homeless with their families because of domestic violence. So I think it's doing that advocacy, that public policy work to get people to see that it's one and the same. Right, and that we need some of those resources in order to help our families get back on their feet.
Great, thanks for that. Does anybody else have anything they want to add to that question before we move on? Okay, So how is racial equity and HUD's COC racial equity analyst tool incorporated in your community? And does your system have data and information on who's accessing their homelessness service system and the outcomes of survivors and families?
So Veronica, in Santa Clara County, we have a system called the point in time count, which is kind of a tally for people experiencing homelessness. And since we are not part of HMIS, we do not use any COC related tools, but just all we need to do is compile our numbers manually and submit that through an email. So we don't really use any of these tools.
Okay. Does anybody else have anything to add?
Yeah, I agree with Aarti, because we both are from the same county. So we are not part of the bigger county system, but they do have a database of homelessness, and they do work on the racial equity part of it. But only thing is we are not exposed to it, or we don't know as much about it because we are not part of that system. But in Santa Clara County, it is very much happening.
And I think we're in kind of a different boat in our county because our homeless housing program is part of our local COC. Our anti-domestic and sexual violence program is not part of our local COC. So we have programs that are able to work together and try to be able to afford wraparound services when that is necessary for folks who are survivors who are needing housing assistance. We can funnel that through our COC funded homeless housing programs. But I think the biggest thing with this question is, yes, we do have data in our counties. Yes, our COCs do have tools to be able to paint the picture of what the reality is for people of color experiencing domestic violence and experiencing homelessness. Yes, we have those things. What are we doing with it? And again, we watched a video at the beginning of this presentation that pointed to a lot of data and statistical analysis that says this is the reality for these populations. That reality hasn't changed because we know this. We need to be able to start taking steps that are able to shift this reality. And we've tried to do some of those things. I don't think we've tried hard enough because we're not seeing a shift in outcomes that we're hoping for. In our coordinated entry system in our COC in Multnomah County, which is the county that Portland, Oregon is in, we have been able to incorporate some equity steps and questions into our coordinated access assessment tools. So we're trying to do that, but when we had our most recent point in time count, we see the same disparities that we saw for the previous 5 years. So we need to be able to do more. We need to be able to acknowledge the reality, and we have data that allows us to acknowledge this reality if we choose to, but we have to be able to take more intentional steps to change that reality. Just knowing that it exists isn't enough to make it different.
Okay. And so you mentioned, when you talk about intentional steps, you mentioned incorporating questions or steps in the coordinated entry process and things like that. Could folks talk more about some of the intentional things that they'd like to see incorporated into these systems in order to achieve this racial equity and attack some of these disparities?
One of the things that I could think about is in order to inform agencies that are receiving, homeless prevention monies, whether it's through the COC or ESG, to provide trainings and inform them on how the tool works. Because you have to do some research in order to get to that information, but there's really no training or intentionality in how to inform agencies, whether they're receiving COC monies or not, on how, not only how the information is collected, but what is being done with that information once it's submitted via the PIT, which we also do, and we have our own database. We do not utilize the HMIS system as well. So we're not too familiar in terms of what the specific trainings that they have when they do those specific trainings, but it would be important to be intentional about that and making sure they're informing the community in general about these tools and how they can utilize it. So.
I think there are very systemic steps that are very difficult to take. We can't take them at a COC level. We can't take them at a program or system level. We have to be able to take them at a federal level. I think that when we talk about, just for us, adding some questions that move us more towards equitable service delivery to prioritize populations of color who have been disproportionately impacted is hard to do because of some of the fair housing laws that we have. I can't say we are going to intentionally serve the African American community with our homeless dollars, because that would violate fair housing law. And being able to acknowledge that we have had nearly a century now of unfair housing law practice that has helped put us into the place where we are, where we see these dramatic disproportionalities in how folks of color are impacted. We have to be able to look at our federal law that got us here, and how are we going to be able to shape our federal laws to help us get to a place of equity in terms of how the housing experience and the survivor experience for people of color. And I think some of those things, again, we can try our best, but at a COC level or a county level or a system level or program level, there's some changes that we can't make. We have to be able to utilize our voices to advocate for federal change in a lot of these instances.
Absolutely. Thanks for that, Sam. That was great. So I'm going to jump into the next question if no one has anything else to add to that. So this is really important when we talk about network. Who are the people that your clients are asking for help and support in their everyday life?
Our clients, the clients that we serve at My3, more often than not, reach out to us because they have nobody else, because they are immigrants. They have left their they don't have a family now because they've left the abusive situation. They have not yet made friends because a large part of DV is where they are isolated from isolation, emotional abuse, and where they have not been allowed to go and mix with people, understand what's happening. So they actually reach out to us most of the time. And we are the ones who kind of guide them. But those people, those who have been have reached out to the social services agency and are already getting some help from them. Some of our clients do reach out to their caseworkers at the social service agencies and are able to get some help through them.
Yeah. May I ask you, how do you mentioned that your clients are often immigrants and don't have many connections here. So how do they find you? How do your clients even know that you exist?
Because we do a lot of outreach. We do a lot, any South Asian events, you will find us hosting a table. We have our ads in the local magazines, the language magazines, and then, yeah. And then also we do a lot of police training with the police departments on the cultural responsiveness about what you could possibly expect when you go into a South Asian DV household, because it might not reflect the mainstream household, because there might be more than the spouse. There might be a mother-in-law, there might be father-in-law, brother-in-law, sister-in-law. So we do a lot of training. And in Santa Clara County, the police departments have a card that they give to the victims when they go out for a DV call. And it lists all the agencies, including ARCI. There are 5 agencies in Santa Clara County. All the 5 agencies are listed on it. And then it's handed over to the person who's going through DV, and then they reach out to the respective thing. And also, we also work with the hospital systems here. And we actually also do training, culturally responsive training for doctors and nurses who meet with South Asian population. And then we leave, we have these small green cards that we leave at many places, and we leave it at Indian restaurants, Indian stores, South Asian restaurants, South Asian stores, in apartment complexes. So if somebody is just going in and they want something, they can just pick up that card and then slide it into their bag and then call us at an appropriate time. And sometimes it is our community members, friends who will call and say, oh, I know this some person who is going through DV, how can you help? Then we explain to them what is the process, and then we start helping them.
Okay.
Veronica, I would like to add, in addition to what Jaya said, in regards to how survivors or victims know about us, we also have something known as Safe Chat. So within, for example, within Santa Clara County, the 5 DV agencies take turns, and besides hotline, we have a Safe Chat, which is a safe mechanism for anyone seeking any help or services related to DV can reach out by chatting, and the advocates can connect them further with other services or agencies.
What we've seen with our, go ahead. So what we've seen with the programs is, although we focus work a culturally specific program, it depends on the family. Sometimes it will go to a neighbor, sometimes it will go to a family member, sometimes it, it's dependent. Sometimes due to their religious belief, they're more inclined to going to a family member because they don't want them to worried and things like that. However, as well as other programs, we do have our outreach and prevention department as well, which we provide pláticas that we call convenings for the communities. And we see a lot of referrals that come from the convenings outreach that we do. We receive referrals from the district attorney's office, other service providers, as well as, it's the word of mouth that gets around. I receive services at Enlace, just go there, they will help you with whatever your need may be. As well as we're always on active, especially now more so than ever, our social medias, our Facebook, our Instagrams. We're having a youth leaders in the community doing presentations, so being very active. And with that, we're letting our program be known within our community, and we do get a lot of requests for services. So that has worked, but I think it just depends on the family. Sometimes they even resort to, if there's religious beliefs, into their own institutions. So it's dependent on where the family's at and what they find support and they feel safe in going to. And our agency is one of them as well. So that's what we're seeing.
Veronica, for the African-American community in Portland that we're serving, it's more often than not us, but it's not because we want it to be us. At SCI, we utilize a tool that we call our relationship model. This is the how of how we provide service delivery. And our relationship model is simply filling relational gaps in the lives of the people that come to us. Our relationship model is defined by a mentor, a teacher, and a parent role. And we are filling gaps that don't exist in the lives of a lot of the African-American community across the nation. We don't have those roles in our communities because they have been intentionally stripped and removed and taken away from us. So the natural supports that we should be able to go to are mentors, teachers, parents, our family members and friends that others are talking about. I think there are some communities and populations who are able to safely access that. And we would love for that to be the reality in our community as well, but it's not. Those roles have been stripped from our community. That's why an organization like Self-Enhancement Inc., SEI, is able to successfully serve that community because we are intentionally filling those roles. Our coordinators and our advocates are being the mentors and the teachers and the parents to people who don't have that, and would love to see us get to a place where we can say, man, our folks, our African-American survivors are able to access natural supports that exist in abundance around them in their communities, and we're not there. Would love to be able to get to a place where, again, that is reality for our people.
And so we have a similar population as well. We service predominantly African American men and women. And the thing that we find is our particular population, a lot of our clients, they come from the foster care system. They've been in and out of the foster care system since they were young. So they don't have parents. They don't have a support system. They've been on their own. They've been teen parents, you know, trying to make it work. Some of them have been in and out of the prison system. So when they come to an organization like Genesee, as you said, like we become their parent, right? Their case manager becomes the person that they lean on and depend on, and for the first time, they feel like somebody cares about them and somebody is hearing them. And so, I mean, you know, nobody comes to shelter, right, because they have somewhere else to go. They come to shelter because they have nowhere else to go. So I just think it's really important to understand that people who come into shelter tend to come to you with nothing and with no one, and that you have to build them up in ways that go beyond just offering them some place to sleep and something to eat. Like you really, really, really have to help build them up, like mentally and physically, you know, and emotionally as well.
Okay. Dr. Angela, could you talk a little bit more when you were talking about building folks up?
Sure. So, you know, I talk a lot about sort of, you know, I use the term culturally relevant, right? Services. And so one of the things that we understand as an organization is people come to, when they come to Genesee, this might be the 4th time they've been in shelter, right? Like this might be their 5th domestic violence relationship that they've been in since they were 12. And so what we have to do is we have to get them to break the cycle of violence. And so, you know, we start with understanding that they might, you know, they might not be able to be self-sufficient. They might be dealing with all this generational trauma and abuse, rape, sex trafficking, feelings of abandonment. So we have to get them the mental health services that they need in a way that they will be able to accept it, right? Because you have to break down all those barriers, because they've been taught they have to take care of themselves and they have to be tough and they can't show weakness. So you have to get through that. They might be uneducated or undereducated. So they're not going to be able to get employment when they leave. So we have to help them, like, you know, if they need a GED, if they want to go back to school, they want to get some type of certificate training program or some type of job. So you have to help them with that. They might have poor parenting skills, so they're not going to be able to take care of their child once they leave the shelter. So you have to help them with that. They might have legal issues, right? Something as small as a traffic ticket, something like evictions that are keeping them from being able to get someplace, you know, permanent. You know, they might have, as we talked to before, they might have immigration issues. So these are things that we have to help them with as well. And life skills issues, again, they've never lived on their own, stuff that we take for granted, like you can't put rocks in the dishwasher, or the you can't iron on the rug, right? These are things that we take for granted because we've grown up in a house and different things like that. So people don't know. And so the thing, you know, people always say, man, servicing Black women is so hard. It's so hard. It's so hard. It is hard because a lot of times when we come into shelter, we have a lot of needs that just, you know, we need a lot. And so being able to really either do those needs in-house or to be able to partner with other organizations that can provide those needs are what is really, really essential into building a client up. And also, it's your attitude. You know, we come from a stance that we're not offering you a hands out, we're offering you a hands up. So everything that we do, you know, beautiful housing, right? New clothing, you know, we speak to you from respect and from a place of love, not from a place of we're doing you a favor and you're lucky to be here and we tell you what to do and you're going to follow our orders. It's like, this is a partnership. You work with your case manager. We're going to meet you where you are and get you to where it is that you want to be. So it's as everybody knows, it's really complex. There's no one size fits all way to do that. And it starts with understanding that.
Thank you so much for that.
Yeah, to add on to what Angela says, that is so true, right? You cannot be condescending to a survivor who comes to be you for help. You can't look down on her and say, oh, you need this, okay. It cannot be charity, right? It has to be like, I'm here for you and I will help you through whatever you need, as long as you need. I'm a friend. The word Maitri actually means friendship. So what we are offering is a friend in time of need to help you. I always call it as rebuilding life, because they have to, what was their life before has been in a way shattered by the abuse that they suffered, right? So now they have to rebuild their life. So we are there to provide them the support and help them through that process. It's not that we are there. It should not never become an hierarchical thing, right? Oh, I'm the case manager, you're my client, so therefore you listen to me what I say. No, you have to actually listen to what the survivor wants, what he or she needs, and then do what they want, right? And help them through it. So I agree 100% with Angela, what Angela says, and that's the way we all of us should be working in this field.
Absolutely, absolutely. So how can the homelessness assistance system, like shelters and housing programs, be survivor-centered and trauma-informed during COVID? Because this is an additional challenge now. And I can imagine that you've had some time now to sort of sort out some answers for that.
So it's been challenging. I think everybody has faced challenges. We've done it by creating sort of a hybrid program. So of course we have, for us, we have apartments, which we're lucky. So people can be in their own apartments. So we don't have to really worry about sort of the communal living, because we've moved our emergency shelter over to some of our apartments. We're doing as much programming as we can virtually. So we provided all of our clients with Chromebooks. And so we're doing all the programs through Zoom. But there are things like that you have to do in person, legal services. So, we're staying kind of safe with that. Like when the clients come in, we're making sure we're taking their temperature, hand sanitizer, washing their hands, all of that stuff. We have an in-house wellness, call it kind of a wellness group, where we have nurses. So we're making sure that they're getting checked out and getting tested as needed. We also have drop-in clients who we're housing in hotels. So though that population needs more, because we know what the clients who are coming in and out of our shelter are doing, but the ones in the hotel, we're not watching 24 hours, so we're making sure that they're getting tested and different things like that. But it's luckily for us, thank goodness we haven't had any cases, but it's it's rough, it's challenging.
Yeah, in addition to what Angela just said, I think it's so important to ensure clients feel empowered to make their own decisions, because they have just walked out from an abusive situation where they've always been told what to do or how they can't do something. And when they walk into a shelter or our programs, we don't want to be the ones telling them what to do. So it's all about helping them feel empowered to make their own decisions, as well as respecting what they decide to do at the end of it without judging or questioning them.
Yeah. To add on to what both Angela and Aarti are saying, one of the things was COVID really shook us up, right? No, none of us ever imagined or dreamed this would happen. If in February somebody had told us that in September we'll be doing a Zoom presentation and sitting and talking about a pandemic that has killed so many people, right? We wouldn't have believed it. And for what happened, the way COVID shook how we worked, right? And while we had to scramble to adapt to the new normal, we couldn't just ignore our survivors, right? The people that we are working with, we had to make sure that they felt safe, that they had the emotional connect, that there was somebody who was like talking to them. So we had to do two things. One is figure out the way we are going to work going forward, but at the same time providing our survivors the necessary tools and the necessary support system that they can also go through that. And one big thing we saw was this was re-traumatizing many of our DV survivors, because one of the things that they faced during their abuse was that the shelter in place was very difficult for a lot of them, because that brought back so much of their trauma, because they were not allowed to leave home when they were living with their abusers, right? So now they are again in a in a situation where you're telling them you can't go out, you can't do this, you can't do that. So we had to be really, really talking to them and explaining it to them. And what we did in March, as soon as the shelter in place came in, was we literally picked the advocates at Maitri. We literally picked up our phone and called each and every one of our survivors to ensure that they were okay. And we asked them, what do they need? Do they need financial assistance? Do they need groceries? Do they need something else? And we started providing whatever they needed. So they needed that kind of support to know that, okay, there is somebody who cares enough about me to call me, right? That itself gave them a boost. So we really had to change, shift the way we work. And now that we are working mostly from home and online, it is a challenge, right? Because not all survivors have the technology or even they may not have a laptop. They are doing everything on their phone. And also they may not be technologically savvy to do some of the things. So we had to walk them through all of those things and then help them. At our transitional housing program, I still go and visit. In the beginning, we said, okay, we are not, since it's shelter in place, you cannot go and meet your clients. But then at one point, after 2 weeks into the shelter in place, I just decided that that is not the right thing to do. These are women who are staying in our housing program and we are their only source of support. And if they don't see us, they are just going to feel so lost and lonely. So actually I went, I decided to go. I talked to my ED. I said, I will make a visit. It's okay. I'll be safe. I'll wear my gloves. I'll wear everything and go. I actually met them out in the parking lot and then just talked to them. And that itself kind of shifted things for them, right? They started feeling, okay, a little better. They said, okay. And every week we would call, check in with them. And even now I make a weekly visit. Me and my colleague, we make weekly visits to our housing program to make sure that the survivors who are staying there are safe and they are feeling supported. And with the other DV survivors whom we serve who are not in our programs, we are always available to them. We are talking to them all the time and giving them all the support that they need.
So
I think sorry, go ahead, Martha.
Oh, go ahead.
I was just going to say, as Jaya said, I think COVID has definitely taught us to be very creative with our advocacy and case management. So every day is so different in how we want to go about dealing with anything that comes our way. So we have been really creative.
So some of the things that we've done is we are doing kind of like a hybrid model to where we're having limited in person and, you know, the majority of our services are being provided remotely. So we're identifying which appointments we could benefit for the in-person, and we provide the options to survivors as well. Would you like to come to the office? We have identified big offices following the social distancing here in the state as well. But one of the things that we've done is having those conversations with our families, you know, having the flexibility, what time works for you? If they have the technology, if they're having a counseling appointment, they don't have to have their cameras on. Sometimes they may not feel comfortable. So I think just having those conversations with them and meeting them where they're at. We have our services, we have a wraparound services where we have our crisis intervention, counseling, legal services. We have our parenting classes, financial literacy classes. So we have so many ongoing services that having those conversations, especially now that the kiddos are back in school as well, and the majority of them are having online school. So I think just having those conversations, what time works better for you? Is it safe? Having those conversations and providing the options, would you rather come to the office? That's also an option. So I think that's very important, and our advocates and our staff have gotten really creative. You know, one of the things is if we have a family that needs a food pantry or needs groceries, okay, so have them do a list and lastly will order it online and they'll deliver it to them if they don't have transportation. So there's so many things, you know, is there documentation that needs to be signed? As somebody said, legal documents, right? They could come in person to sign them, or they've been mailing to them, including an envelope with the stamp. So for them, so they won't have to, you know, if they don't have stamp, they could still send it. So they've really gotten creative around providing the services to ensure that our survivors, there's not extra barriers that are being added. And we're one of the programs that believes that our survivors are the experts in their situation, and we're just here to help them navigate through this complex systems, right? So we're firm on that. And I think the main thing that we can do and implementing or even processes to ensure that survivors are being met and the services are being provided are trauma informed, it's just listening. Just listen, believe, and support. Those are the main things. And whatever comes after that that's just what it is. And each family is in a different place. So not making assumptions that because something worked for this family, it may work for this other. So I think it's more having those conversations, listening, and supporting them the best way that you can, even working remotely. That has been working for us. So we're still learning, but we're getting there.
Okay. Anyone else have anything to share about shifts and changes?
Just a couple real quick things. I know we've been on
Go
this for
ahead.
a while, but
Go
I
ahead.
think in addition to what folks are saying, I would just summarize by saying the biggest thing is your attitude and your mindset. I think Jaya and Dr. Angela both touched on before. You can't have a mindset that says, I'm doing you a favor. Your mindset has to be, I am here for you no matter what. And I think that mindset is the most important. The other thing I definitely want to bring up is COVID is a beast for everyone. This has been a terrible experience worldwide. But when our general population is suffering, we can rest assured that our marginalized populations are suffering more. And being able to acknowledge that and understand that reality, I think, is very important in being able to successfully respond to how are we going to provide effective service delivery to marginalized populations in the midst of this pandemic. And we are trying at SEI to make sure that how can we be as relational as possible? How can we hold to our core model and values and be safe and ensure that our community is safe as well? And as others have said, that has opened up lots of creative opportunities for us to take steps that we might not have taken otherwise. And that's the last thing I want to say is COVID has been something terrible. This pandemic is not something that any of us would have wanted, but the reality is we have been moving closer and closer towards being a virtual world for a long time. And some of our culturally specific agencies have been doing the best they can to keep up with that trajectory. But a lot of our populations have been getting left behind. And this has been an opportunity for us as culturally specific providers to take steps, again, that we might not have otherwise taken to help shift our communities towards that direction and provide a level of empowerment that we may not have done as quickly if we weren't forced to do so because of the situation we're in right now. A lot of the stuff that we're doing at SEI, we say like, man, why didn't we think to do this last year? This is effective with or without COVID. Some of the virtual options that we're doing now, and we'll continue to do them after we do, God willing, have a vaccine and we're all back to some semblance of what we were more used to. There's a lot of things that we'll continue to do because we were forced to be creative and come up with ways to effectively serve our communities through this pandemic.
Thank you for sharing that, because I think a lot of people, I mean, yes, it has been challenging, but I do a lot of outreach and education, and from an outreach and education arm, it has just opened up so many opportunities. I've been able to reach people nationally that I would not have been able to reach. It's forced me to think of new and innovative ways and programmings. So on the prevention and outreach arm, it's been great. It's just the intervention arm that's been a little bit more challenging.
Well, let's jump to our last question before we open up for questions from attendees. Have there been any innovative partnerships that have arose during this time under COVID?
So I think COVID is a piece of it, but the biggest piece that we've seen at SEI as an African American organization is kind of the social justice awakening that has come about as part of just the Black Lives Matter movement in response to some of the violent tragedies that we've seen over the past few months. So one of the things we talk about now in our executive leadership team is like, man, we have to take advantage of this. Like, shoot, Black is in right now. We get calls from funders that we didn't get last year. Now we're getting that call saying, how are we able to help serve your community? And that, I don't know if it's a transformation, because that would entail that it is a permanent shift in how we think. But for the temporary potentially situation we have right now is something that we absolutely are trying to take intentional steps to take advantage of. And again, we have been able to embark on in partnerships and funding opportunities and opportunities to build program and service delivery that we weren't able to access as easily before. So that has been something that has come of the situation we're in right now. I think that COVID is a piece of it, but for us, the biggest piece has been just, like I said, kind of the social awakening of Black lives. And I would even say that like minority populations are at the forefront of our consciousness. And for more people than they have before, we are able to say that those services matter. Those service delivery opportunities matter. Those populations who are suffering matter, and we are able to be intentional to make sure that we're serving those populations effectively.
So for us, it's been, as everybody knows, whenever something like this happens, you're servicing the clients you're already servicing, and then there's more people that need your help. So the city of Los Angeles has partnered with us to be able to offer more services to people in the community who are victims of domestic violence who we can't house. So we've gotten funding from them, hotel vouchers, to be able to put community, people in the community who are victims of DV who can't come into our shelter for whatever reason in these hotels, and to be able to provide them with the same supportive services that we provide our residential clients. So that's been like an additional 90 clients that we've been servicing, but that's a decision that you have to make as an organization, right? Because you're right, we're getting all these phone calls from people. We want to help you, we want to give you money, we want to do this and that, but you have to look at your organization and say, can you say yes? Do you have the capacity to do this work? And so, you know, as an organization, before you take on any partnership or before you do anything else, you have to look at your staff and say, can you do it? And that's a decision that you have to make. For us, you know, and I think for a lot of DV organizations, because we come from a place of wanting to save as many people as we can, we're going to say yes, and we're going to take the partnership, but that's not always the best thing. And so I just caution people, like, this is great and fantastic, but just really look at the capacity of your staff, because they have to do self-care and be taken care of too.
Yeah. So like Angela said, even here we have the motel funding has helped us motel clients when we were not able to find shelter space for them so that they had a safe place to go to. That's been a huge help for our agencies. And then we were also having COVID fundings that is available in Santa Clara County that we are able to access for our survivors. And also the interesting thing is there have been many small agencies that have kind of reached out to us, while they may not have a lot of money or a lot of things to give us, but they are willing to say, okay, do you want grocery gift cards? We'll be able to do a collection among our people, and then we'll give you. So that way we got lots of grocery gift cards. And another thing that actually helped us was getting this free ride codes for Lyft and Uber, right? Because many of our survivors do not drive a car. They have never driven. They don't know how to drive. They've always used public transportation, right? So in a situation in COVID where they are scared to go on a public transportation, we have been able to help them with this Lyft ride coupons or Uber coupons. And also we have been reaching out to our community to increase our funding. And through that, we have been able to give financial assistance to those of our survivors who needed it during the COVID thing. The biggest thing was people who lost their jobs, right? The shelter in place. And these are all people who were like in a babysitting job or some hourly wages job where they lost it and they had no recourse. Where else could they go? So they again came to us, and then we keep looking out for for funding and whatever we can, whoever is helping, and then trying to see if we can connect our clients directly to them, or we can partner with an agency and then give them. But like Angela says, it is so true, right? Because agencies are short-staffed. Most agencies are short-staffed, right? And if you take on too much, you may not be able to do justice to it, right? So you may end up not actually helping in the way that you want to. So because you also have to take care of the staff, because everybody is going through COVID, everybody is dealing with the new normal. So we'll have to balance both of it. But please keep looking out. I think most places there is funding available. People are willing to help out. Just keep your ears and eyes open. If there's an opportunity, just go there and see if that will work for your agency and for you, for the population that you're serving.
We have also collaborated. We've built new partnerships with different service providers, and where they had extra monies from private donations, where they assist survivors with deposits, rents, hotel stays. So we're collaborating, as well as with the coalition. We receive monies from the New Mexico Coalition to End Sexual Assault here in New Mexico, to provide emergency assistance to survivors, and that includes utilities. Utilities, even with phone bills. A lot of times, most of the service providers are providing services remotely. And a lot of times, if a survivor doesn't have the phone connected, how are we going to connect with them in order to better support services? So we've gotten creative in terms of things that we've been able to do. Community foundations, we receive money. So our main focus, one of our main focus has been, those emergency monies to be able to provide the huge need of requests for services, resources specifically, that has increased drastically. Many of our families, the majority have not lost employment, and they don't qualify for any type of benefits, unemployment, or anything like that. So those emergency funds have been able to provide families not only, rental assistance, but also, like I said, food, utilities, and things that they need during these times. So that has been very helpful. And just, we've also received requests, even other agencies that we've normally tried to connect with them, that they've reached out to us in an effort to collaborate. And we're always, yes, of course, what can we do? If it's going to benefit our families, let's find out, let's find a way, let's create a process where we can support and collaborate. So that's something that we've seen, and our families have benefited greatly. Another program that we initiated was with the Family Initiative here in Albuquerque, and where they had this monies where survivors, up to 100 families benefited, where they were able to sign up to receive $500 each family, which was directly going to them. So we've just been able to get creative and find any monies that are available so we can support our families. So there's been different collaborations that have emerged during these times that we hope will continue.
Okay, thank you for that. We have quite a few questions that have come into the chat, and they're great questions. A lot of these questions are around affordable housing. So one question is, how can we break barriers such as income, evictions, felonies, etc., in addition to finding stable, affordable housing? There was also another question from the city, Milwaukee, also talking about ways to find affordable, sustainable housing. And then in New York, single mothers struggling for housing and rental assistance, so affordable housing around that. So anybody wanna speak to that? The barriers such as income, evictions, felonies, etc., in addition to affordable housing.
I think a lot of those barriers are very systemic, and depending on where you are in the context of any situation, it can be a different answer or difficult to talk through. How are we going to overcome that barrier for this situation? But I think where I try to get to when we see those kind of examples is, what are the steps that we can take to show who you are, who you really are, not what your barriers might look like on paper, not what your eviction record says about you, not what your criminal history or accumulated debt might say about you, but how can we demonstrate who you really are and show that picture and make sure that decision makers around your ability to access housing are able to see you and not just see what you might look like on paper. One of our fundamental beliefs at SEI is we see people for who they can become, not necessarily who they are today. And being able to demonstrate that for folks, again, who have the capacity and the power to make these kind of decisions is always our goal. And again, there's a lot of systemic barriers that are in place when we're talking about access to affordable housing in different community environments. But that for us is at the heart of it. Another thing is, what steps can we take to increase access to affordable housing? I know in our region, which is the 3 counties that border Portland, Oregon, and the region where we just passed an income tax bill where we were able to create affordable housing funding by building a 1% tax on businesses that earn over a specific amount of revenue. And that will generate in perpetuity for the foreseeable future up to $250 to $350 million a year specifically for affordable housing. We have been in the midst of a homelessness and housing crisis in our counties for the past 10 years. And ever since the economic downturn of 2008, we've seen homelessness spike tremendously in our communities. And we also know that when hardship spikes, violence spikes with it. So we've seen an increase in domestic violence occurrences in our communities, and being able to respond to that in a way that allows for, like I said, an increase in affordable housing. I remember when I first got into this work, when I first started working for SEI and started working in our homeless housing program and that part of what we do, the reality in our county was, if we had enough money to house every single homeless person in Multnomah County, we didn't have enough places to put them. So it wasn't a funding issue, it was an access issue. Like, there wasn't enough. And being able to increase that and take steps systemically to create vehicles to increase that are some of the things that we had to look at doing. And again, I think some of the opportunities that have been created in the past 6 months have really helped towards that end. I mean, it's not necessarily creating new partnerships or coming up with new ideas, but our old partnerships are having different conversations because of the situation that we're in right now. And the willingness to engage in good faith conversations is greater than it has been at other times when I specifically have been doing this work. And that has allowed us to take some of the steps that we've been able to take to try to begin to overcome some of the barriers that we're talking about in that question.
Okay, great. Thanks for that. I think we have time for one more question. So why does it seem that African-American women, when housed, don't stay in housing? What can we do to make them more comfortable? Dr. Angela, do you want to?
Yeah, so it's a lot. I'm trying to keep it succinct because I know we don't have a lot of time, but a lot of it, is everyone familiar with the term implicit bias, right? So that sort of seeps into a lot of research shows, right? And it's not just me saying it. Research shows that when Black women tend to try to go into quote unquote traditional services, they suffer as a result of implicit bias, right? So they go into these shelters, people don't understand their cultural norms and values. They don't understand why they're reacting the way that they react. And so they just get labeled as difficult, right? Oh, she's angry. Oh, she doesn't want to program. Oh, she doesn't want to do the restraining order, and so they come into a situation where they feel like nobody understands them and they almost feel like they're being re-victimized, right? Also, a lot of the times too, it goes back to what I was talking to earlier, because Black women need so many services. Sometimes when they come into shelter, they don't really feel like it's helping them. Like, okay, they came into the shelter, they got a good night's sleep for a couple of days. Now what? What am I supposed to do now? And so it just I mean, that's basically kind of the thing where you're working, you have to try to figure out how to kind of speak to them in a way that they understand. And it's difficult. It takes training, right? And people come to it and they have all the good intentions in the world. But I've actually had people call Genesee Center and say, can you please take this client because we do not do well with Black women? And it's like, what do you mean you don't do well with like Black women?
Wow.
It's this othering, right? That's already taken place before, you know, you even had a chance to do it. And we all know that, and again, this is not me saying it, you know, Black women tend to have what we call a superwoman complex, right? Where we're okay, we're fine. And so we don't present, right, as the typical victim might present. And so that causes problems too with the people that we're supposed to trust. There's already this mistrust of social services, right? So I'm scared that I'm going to reach out to you and you're going to take my child away from me, right? Or you're going to put me in jail. Or you're going to put my partner in jail, which is not really what it is that I want. You're trying to label me as crazy because you're trying to get me into therapy, and that's not what I want to do. You're trying to get me to program and go to classes. I don't like school. I dropped out of school at like 6th grade, you know? And so it's all these things that you have to sort of kind of take into account, and it's really complex. And I know I'm babbling, but you know, it's just it's so complex, you know, and I feel like I can't really do it justice like in the 5 minutes that I have to answer it. But you know, it's, you know, and then I want to also caution people too. Always there's a saying, right? Skin folk don't equal kinfolk, right? So just because we're the same color, that doesn't necessarily mean that I can understand you either. Like I came into this work with no social work background and no understanding of domestic violence. And I had to check myself and my implicit bias about the type of person that's a victim of domestic violence, right? And it was taking the judgment out of it, because we tend to judge people, right? And it's taking that out as well. And people can sense when they're being judged, right? So if you're in a situation that you don't want to be in, you're already uncomfortable because you're in a shelter and you feel like you're being judged and talked down to and not misunderstood, you're not going to stay there either because you figure you could do bad all by yourself, right? And so that's kind of the thing too that's going on as well. So
Thank you for that.
Veronica, I just want to say one thing real quick that Dr. Angela might not feel like she can say because she is a Black woman, but Black women have a superhuman complex, a superwoman complex, because Black women are super women. Like, they are superhuman. And there is not any single population entity that has been through as much in the history of this country than Black women. Like, we have put Black women through so much, and the fact that they're still here, like, is superhuman. The fact that we have been able to persevere as people largely on the strength of our women is because of some of the superhuman resilience that Black women have demonstrated over the history of this country. And again, that's not necessarily answering the question of why Black women are experiencing some of the things that they do in our services, but I definitely just wanted to say that there is no stronger single entity that has demonstrated a level of strength in the history of our country than Black women.
And I want to say too, a lot of times Black women get we get labeled as difficult because we've been taught to come from a place of strength, right? So our pain comes out as anger. So we lash out at the people who work at the shelter, and it makes people scared, right? She's angry, she's violent, she's difficult. And so sometimes Black women don't get the chances to stay and to work through all of that, to get to the core, because people are like, oh, you know, I can't deal with this. This is just out of control, right? And so that's another thing too. It's just understanding that anger is pain, and you have to be willing to love the person through that. But if you don't understand where it's coming from, if you don't understand it, and you come from the thing, oh, this person is violent, this person is angry, this person is a threat, and then, you know, the situation gets worse instead of better.
Absolutely. Thank you so much. And thank you everyone for this discussion. We are right at time, so I'm gonna let Debbie, are you gonna hop on with the last of the slides?
Hi everybody, I'm back. One more time, I've just been really grateful to you all for this conversation and sharing all of your wisdom and information and experience. I've just been thinking a lot about how, we've been talking about undoing systems and addressing systemic racism. And I feel like there's a whole other conversation about like how white people can get out of the way and like some of the ways that we create gatekeeping and so much in terms of doing this work. But, I feel like this is a beginning of a conversation that needs to continue, and that's the chat, that's people are saying in the chat box. But yeah, there's so much work to be done and so much more that needs to happen. And we're at a time that I think we need to keep doing this work and keep beating the drum to make it happen. And not, like the change is going to change. Things are going to change. Like I don't like when people talk about going back to normal, like that's not, like there's so many things that you all talked about that were very inspiring at the end in terms of just like how systems and things are shifting. And so like, let's keep moving to the new reality and the new future we want to build that's shifting power. So that's all I have. I don't know if anyone else wants to say anything else, but I just appreciate you all for being here and taking the time out of your busy lives.
Thank you, everyone.
Thank you.
I appreciate your contributions.
Thank you.
Thank you.
It has been